So we're not going to belong the time. I'm Jessica Wright.
And I'm Ishonda Blue.
And we are the co-founders of Innovative Senior Care Consultants. And we are here tonight exclusively VIP. You all are special, very important. We have an exclusive webinar here tonight to teach you, to spill some tea on how to start your profitable senior care business. Are you ready? Can I get a yes? Can I get a hands up? Can I get something? Are you ready? Who's ready? All right. Monica's ready. Janisa says she's ready. Sasha got her hand up. I see you, boo. Yes. India, welcome, welcome. Listen, we want to know where you are repping tonight. We want to see all over the United States. We want you to rep your city. So if you can put your city in the chat. ATL is here, Baltimore is here, Stonecrest in the house, Dawson, Georgia's in the house. Awesome. I see Biana, our neighbors, in the house. Welcome, welcome, North Carolina, Florida. Yes, Texas always be in the house.
Yeah, yeah. I see Chicago in the house.
Oh my goodness. Yes, I love it, love it. Maryland's in the house. DC's in the house. Welcome, you guys. Welcome, welcome, and welcome. So listen, I have one rule and one rule only. And that is, I need you all to be interactive with Ishonda and I on this evening. Because let me tell you, the more you interact with us, the more you respond, the more you're going to get out of us. And we're ready to shed all the tea. So if you interact with us, I'm telling you, it's going to be a powerful 1 hour. You won't regret it. So put on your seatbelts and let's get ready to ride. Are you ready?
All right. We always have to start off by letting you guys know who we are. We are the sisters. We are the senior care experts. We are registered nurses. We have over 20 plus years of experience in long-term care. We started this with a very personal experience of taking care of our grandmother, who was our very first client. We have grown our business, Innovative Senior Solutions, to over 20 million in lifetime sales. We sold a successful in-home care business in 2019 for over 7 figures. And now we're currently operating adult day personal care homes and transportation for seniors. And we are consulting to help individuals like you start your own senior care business. We also provide coaching and mentorships and a mastermind. So that is just a little bit about us on tonight.
So yes, we are the senior care experts. So tell me if you're ready to position yourself to enter into the billion-dollar industry. If you're ready, I see you all say ready. You got your seat belts fastened. Yes, because listen, we are passionate about this. And so we want to help others enter into this space. And so I'm not going to be prolonging the time, but I'm wondering who we have on tonight. So if you are an aspiring business owner senior care business owner looking to get into the senior care industry, let me see you put a 1 in the chat. If you're an aspiring entrepreneur and you're wanting to enter into the senior care industry, let me see you put a 1 in the chat. Okay, we got some 1s coming up here. Okay, Patrice, I see you. Shamika, I see you. I see you. Aisha. Yes, yes. Nikisha. Okay, well, guess what? You're in the right place at the right time. You're here. We're here to help you position yourself to get ready to enter into the billion-dollar industry. So I want to know, let's put a number 2 in the chat, because we have some real estate investors who want to use their real estate in the senior care industry. If you are a real estate investor and you have property that you want to use in the senior care industry, drop a number 2 in the chat. Let's see who we have. Paya, Monica, Janicia. Okay, we have some real estate people in the house. Welcome, welcome, and welcome. We love to talk about how we can take rental payments of maybe $1,000, and we can show you how to use your rental property in the senior care industry and not double, triple, but we're talking about 7, 8, 10 times that amount. Are you ready, real estate investors? Let me see you say yes. So now, last but not least, I want to see my entrepreneurs already who's running a business, who's already a boss, that want to get into the senior care industry, who want to add a 6-figure business to their portfolio. Let me see you drop a number 3 in the chat. If we have some entrepreneurs already who are doing their thing that want to come over to the senior care industry. Yes, I see you. I see you, Deandra. Oh, Janisa says she's 2 and 3, boo. Okay, I see you. Annie, I see you. All right, welcome, welcome, and welcome. So let me tell you, no matter if you're one of the 3 and that I've just mentioned, because I'm telling you, you're in the right place at the right time. So let's get started. And how I like to start with sharing with you the numbers, because we all know that the numbers don't lie, right? The numbers are the numbers, the statistics, that it is what it is. And so I like to start off with the facts. And so the fact is that the senior population is the fastest growing population. If you're in the state of Georgia, 10,000 individuals turn 65 every single day. Now, in the United States, over 1 million people turn age 65 every day. And so let me tell you, there is a 75% increase, a 75% increase in the need of providers in the senior care industry. So that's why I'm telling you, you're in the right place at the right time, because we need you all. We need providers to come into this industry and help the growing need of the baby boomers. So we don't call them baby boomers here in the senior care industry. We're saying that it's a silver tsunami that is coming our way. And you all know what a tsunami is, right? A tsunami is huge, it's massive, it's destructive. And let me tell you, that is what is happening with these seniors. They are disrupting. They will be disrupting this industry for the next 20 to 30 years. So this is no fly-by-night industry, you guys. So you're not going to get in and then it's going to hit a dead. No, we're talking about for the next 20 to 30 years. Yes. This industry will be booming. So again, I'm telling you, the time is now and the time is right.
Jessica, let me answer this question. When we were at Dartmouth, how many years ago it's been?
3, 4.
I think 4 years ago, when we was at Dartmouth and they were talking about the top industries, the future industries.
Yes.
What was on the top 5?
The senior care industry.
There it is.
So listen, I'm telling you, I want to give you the facts. I want to give you the statistics, the stats, the numbers, because those do not lie. And so we want to help you enter into this space. And so we have a proven system, and you see it on our slide. Following a proven system equals success. And so that's what Ishanda and we want to provide to you on this evening. We want to help you enter into this industry, not only enter in, but be successful.
That's right. That's right. So now we want to talk to you guys about the challenges to starting a senior care business. Now, if this is you, as I call them out, put your number in the chat. Not knowing where to start. If this is you, put a number 1 in the chat. Not knowing how to get funding. If this is you, put a number 2 in the chat. Not knowing all the requirements. I'm telling you, they give you a book like this, right? Print it off. Let me move over like this. Yeah. Not knowing the requirements. Number 4, not knowing how to create a business plan. I can't tell you how many people we have met. Some of them have already started and don't have a business plan. Let me tell you, you are going to need a business plan. Number 5, unsure what type of senior care business to start in the first place. Like, which one should I start? And then number 6, worrying about having to do everything on your own. And let me tell you, that's a scary place, because that's what it looked like for us when we started. Nobody would tell us anything. Nobody would share any information. It was pretty much like if you wanted it, you had to go get it on your own. So
listen, I see you all. We didn't even have to say it. You all are being transparent. That's what I like, Paya. I saw Zebia, Ronika. If it's all of them, it's all of them. And so that's what we want to do here in the senior care industry as senior care experts. Shonda said we didn't have anyone to show us the way, to tell us, but we want to help you because we know how it was for us. Yes. And so we want to make sure we shed light on how to start, on the funding, the business plan, because let me tell you, the business plan is the Bible. I call it the Bible to your business, because if you do not have a plan, I think it said if you have to write the vision and you have to make it plain for you to be able to run with it. Is that what it says? Mm-hmm. And so when you that's the business plan. And so when you have a plan, you have it written, you know step by step what you should do, then you can run with it. And so we want to help you with all of those challenges. I mean, our chat was blowing up, 1, 2, 3, all of the above. And so we want to help you with these challenges. Are you ready?
We just want to talk a little bit tonight about things you need to know to start a senior care business. And I have to share this before we get moving. That is a picture here of our grandmother. She passed this year right before her birthday in February. And that is my daughter, Kayla. Kayla has been working with us since she was 16. Kayla's 27 now. And she started out as a caregiver. She worked for a caregiver for quite a while. And then we finally promoted her to office assistant. And then she got promoted to marketing. And then she was a manager of one of our homes. And she's getting ready to open her own home here soon. And I just bring that out because there is generational wealth here. Like my son also worked in the business. And I just wanted to share that, like, you can leave legacy for your family. So if you're interested in legacy, put legacy in the chat. Legacy is here in senior care. We're going to talk about, that's one of the secrets we're going to talk about later on.
Legacy, generational wealth. We're talking about, you could put them both on there. If that's what you're looking for,
yes.
You know, that is what you can have. That's okay. No kids. I don't have any kids, but I have nieces. I have nephews. You have someone, I'm sure.
Yes. And legacy looks different for different people, right? If you don't have kids. So we're going to talk about that too. Yes. All right. So things you need to know about starting a senior care business. One, we want you guys to know the different types of senior care businesses that are out there. Number 2, we want you to kind of get an understanding of how to get paid in this industry. And then we're going to talk about some things that you should consider before starting a senior care business. Now we're going to talk about the types of personal care, the types of senior care businesses first. Now, number 1, is personal care homes. Let me back up before we even go into the personal care homes. Number one is in-home care.
Yes.
And I want to talk a little bit about our mission and how we got started doing this. And like we said, our first client was our grandmother, and how she became my first client was she was living at home. She needed a knee replacement. She refused to have the surgery. So eventually she got where she couldn't walk. And so she was going to have assistance to be able to live at home. And she told me and Jessica, she said, I do not want to go to a nursing home. And we saw a need in our area, and we started doing in-home care first. That was the first service that we started providing. And we still believe home is number one. Home is first. In fact, our mission statement for what we do is to improve the lives of seniors by keeping them safe in their home or community as long as possible. We worked in a nursing home. We know what that looks like. If there is a need for nursing home for those people that need 24-hour skilled care. But if that is not your need, you need to be home or in a community setting first, right? So one type of senior care business is in-home care, okay? Another type of senior care business is personal care homes. These are residential settings in the community for seniors, right? These also they're not institutionalized. They look like homes. They feel like homes. And those are another way for seniors to live in the community and stay a part of the community before going into an institutional setting.
Yes.
Okay. And then you have adult day centers. Adult day centers is where seniors come in the morning and they go home in the afternoon. There are a couple of types of models. There's a social model and a medical model. Both are going to give you socialization and engagement. The medical model, you can actually get health care there. I think adult day is like the best kept secret.
It is.
And it's going to be boom. In the next 10 years, I predict that senior care business, along with in-home care, they're going to go through the roof. They're going to go because there's so much value there in adult day that you can get. And that's another way. These are all ways that seniors can stay either home or in the community, right? So these are some types of senior care businesses. We also do transportation. Of course, there's all kind of transportation out there, but you can actually do transportation for seniors.
That's right.
And specialize in transportation for seniors. So that is just another type of senior care business out there that you guys can choose. We think it's very important. You're going to learn later on tonight. We got a coaching program where we help you decide which type of senior care business is right for you. There are all different things that you should look at when you're making that decision. Your budget, your lifestyle, right? How much time you want to put into this. Those are some things that you need to consider when you're trying to figure out which type of senior care business is right for you. All right, next we want to talk about knowing your payment options. These are the two primary ways that you're going to get paid in this industry. One is private pay. That's where self-funded seniors who pay with their private funds, right? Private pay. And then you have Medicaid. Medicaid is when you qualify as a Medicaid provider, you can get reimbursed for Medicaid services. And these are usually for seniors who are low income. These are the seniors that are going to qualify for those Medicaid waivers. They are low income seniors. Usually they only have their SSI. And if we had to talk a little bit about the two, and let me not leave out these two as well. VA also pays for this types of service. VA, veteran assistance, and then long-term care insurance as well. VA has its ups and downs, or pros and cons, should I say. You know, of course, if you have been in the military or a spouse, those people do qualify for a VA program that pays for this type of service. The issue that we have experienced as a provider is it just takes so long to get reimbursed. You know, sometimes it took up to 90 days. So That is just one of the pros and cons of dealing with VA. Long-term care insurance is, I mean, that's the way to go. It's almost like private pay, really. With long-term care insurance, either they're going to reimburse you or they may reimburse your client and the client reimburse you. What we found was that so many seniors didn't even know they had the policies, have the policies and are not using the policies. Wow. So I just want to make sure you guys know about long-term care insurance. It pays for in-home care, adult day, personal care home, you name it. It pays for senior care as well. My strong recommendation, now, if you can get all private pay, have at it. And the reason why I say private pay, if you can get all private pay, because then you get to choose what you want to charge. You get to, you are the author and the finisher of that, right? Mm-hmm. But what Medicaid reimburse, you have no control over that. So whatever they reimburse for those residents, that's all you're going to get. You can't change it. But with private pay, of course, you can. The benefits of Medicaid, just you have to check on me with if we have any questions. And if y'all have any questions, put them in the chat. We're going to do a little QA at the end as well. But with Medicaid, the good thing about it is consistent. It's on time, every time, right? Right. You don't have to go looking for a payment or asking anybody for a payment. So that is one of the benefits or the pros for Medicaid is very consistent, it's on time. But of course, my recommendation where I was going is that you do a mix. Yeah. If you can do a mixture of the two, that would be, you'll be in a really good place.
How long is the process to be approved for Medicaid?
So it in Georgia, I don't know about if this is true for other states, but I know specifically in Georgia, they used to make you wait a year as a provider. Like you had to show that you were capable of being a provider. Mm-hmm. You had to have at least 2 clients. That's right. And then once you got that, because I think they give you like a provisional license, and then and you have 1 year to get your official license. And like when you get 2 clients, they say you call us and they'll come out and do a survey. And then once they survey you, then you can get your official license. And then after that, you can apply to be a Medicaid provider. So to answer that question, around a year. Okay, Denise has applied for her Medicaid. Congratulations. All right, some things that you should consider before starting your senior care business. I think Jessica already knocked this out the park, but she talked about that business plan and your financial projections. We had a really good speaker, was it last week or the week before, that talked about funding, how to get funding for your business, and she touched on this too. She said a lot of people come to them asking for funding. She works with a financial institution. And she said the number one issue is people don't even know how much money to ask for. You know you need funding, but you don't know how much to ask for. Well, if you've done your business plan and your financial projections, you would know how much money to ask for. Yeah. You've got to do your homework. You've got to do your research. You need to know about the industry that you're getting into. You need to have a business plan. The business plan components talks about, first of all, your vision, your mission and your vision and what you plan to accomplish and what are you going to do with your business. You know, you need to have a marketing plan. You got to have those financial projections. That's going to tell you your startup costs. It's going to tell you what your cost is to do business. Right? It'll let you know when your break-even point, because when you start a business, you're not going to automatically be profitable. No. It's going to take time, right? So you need to know how much time is this going to take me to be profitable? How many clients and residents I need to have at this particular point, 3 months in, 6 months in, right? When am I going to break even? When am I going to become profitable? Right. You know, we like to share our story about the fact that it took us 3 years to become profitable. Now, we did continue to work our businesses, you know, for those 3 years. We wasn't all the way in, but it took us a while to become profitable. And a lot of people think you start your business and you're going to automatically be profitable, and that's not always the case. Do you know your state regulations, right? Do you know those? Do you understand those? Do you know what's required? Do you know how big your facility can be? Do you know how many residents you can have? How many staff members you need to hire? What are the fire safety regulations? These are things that you need to know. And these are things that we teach, by the way. So we try to make sure that you understand those state regulations and break it down and make it understandable. Number 3, do you know that a financial investment is required? Anytime you start a business,
anytime,
you got to have a financial investment. You can't start a business for free. Okay. So we just want to make sure you guys are aware that you are going to have a financial investment to start a business. Number 4, do you know that marketing is essential to your success? Just, you want to touch on that just a little bit.
Essential is the key word. So it's a must. It's a necessity that you market your business. If McDonald's have to market, if Nike has to market, so do you.
That's right.
And so let me just tell a personal, we have all kinds of stories. So let me just share a personal story of when Ishanda and I started our business 15 years ago. Our revenue for our first year was a whopping $1,694. Can someone put that in the chat? A whopping $1,694. I'm not talking about our weekly or daily rate yep, thank you, Monica. Thank you, Shanera. That is what we made our first year of business. And so, as Shonda said, we were halfway in, we were working our jobs. We just thought the business was going to come to us, right? But we saw clearly after that first year, we had to do something. And so once we bought in, we came both feet in. We went from $1,694 to a 6-figure business, over $300,000 in a year. So, and let me tell you, we went on a marketing frenzy. Yes, we went everywhere. We marketed every day. And when we did that, we saw the benefits. We went from $1,694 to over $300,000 in the next year because we marketed. That's just how vital marketing is. People like to hire everything else, everybody else, and don't hire marketing. You need a budget for marketing. So again, if Nike has to market, if McDonald's have to market, you have to market also. Yes. So I'm telling you, it's essential. We saw the benefits. And I'm talking about we marketed everywhere. We did unconventional marketing. We were in parades. We did it all. So let me tell you, we got all the tea. We can tell you all the places you need to go that no one thinks about. But let me tell you, we were reaching the people that was our avatar, the people who was going to need our services. Let me do a quick check. Question, audience, who is the avatar? Who are the people that you're going to be marketing to?
Good question.
Tell me, drop it in the box. I want to see. I want to make sure. LaQuanda said families. the elderly and their families. Monica, I see. Yes, yes. The children, yes. The adult children of the seniors, yes, yes. The mental disabled, hospitals, government, bed, yes. Up the power of attorney, yes, yes, yes. Tell them, tell them.
So, out of all the years when we ran our in-home care agency, we got calls all day long after this marketing frenzy. But guess who was calling? It was not the seniors. It was their children. Mm-hmm. That is your avatar. The seniors don't think they need help. If you don't believe me, ask them.
They're going to deny it to the end. And so listen, all those things, yes, we went all those places. But let me tell you, you got to talk to the children. You got to get to the people who are going to be able to make the decisions. Who got to make the decisions at the end of the day. So all of them are correct. Yes, yes, yes. Thank you all.
Very good, very good. And then the last thing that we want to tell you is, do you know the importance of your senior care business location? Location is key.
Yes.
Okay. For so many reasons. One, it can determine how many residents you can get. Now, in the state of Georgia, you can have a 6-bed personal care home and a 3-bedroom, 2-bath house in a neighborhood, if the zoning allows it, if the ordinance allows it. That's what we mean by location. Location is key, because you can be in a particular neighborhood and have an ordinance that says you can only have 3, but the state says you can have 6. Mm-hmm. So location is key. And then we already talked about private pay versus Medicaid. Well, if you are going to serve that private pay population, you got to be in that private pay location. Okay, so location is key. Don't think you can just put up, because you can start a personal care home in a mobile home. Don't think you can just start up a personal care home in a mobile home and think you're finna be asking for private pay. You ain't gonna get it. So we just want you to know to really think about location. Location is key.
Yes. So tell me, are you all learning some things? Are we dropping some nuggets here on tonight? I need to know, is this being beneficial? Yes, 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 yes. So can in-home and personal care intertwine, or is it best to keep separate?
Ma'am, who asked that question? They moving in so quick.
Let's see.
Aisha, that is a very good question. So let me tell you about this flywheel. We finna drop one of the nuggets.
Oh my goodness, y'all are just pushing us. Y'all are really doing it.
This is one of our secrets. We finna go on and drop it.
Okay, you gotta hold. You gotta wait. You gotta wait. You gotta stay. You gotta stay tuned.
Oh, she's gonna make you wait, but it's coming.
Yep,
it's coming.
They all in my earbuds. I said, stay tuned. Stay tuned. Stay tuned.
All right, we're going to come back to that. So we're going to talk about starting. This is a little checklist we got for you guys for starting your senior care business. People want to know how to start. Mm-hmm. What do I need to do? Yes. First, form your business. Okay. Get your LLC, get your tax ID number. Next, work on the business plan. Mm-hmm. Please don't pass go without doing your business plan. Work on your business plan. Okay. 3, secure funding. You want to start now. You want to know when it's time to borrow money. Now we can borrow money to buy cars, and we can borrow money on credit cards. This is the time that you should seek funding when you start your business.
Can I have people put OPM in the chat? If you're down with OPM, I'm talking about using other people's money. That's what I'm talking about. Yes. When you want some funding, we had to learn it the hard way, but we feel so liberal tonight. Let me tell you, don't use your money. You want to use OPM. You want to use other people's money. Okay.
Let me tell you what was enlightening for us when we went to Dartmouth. So when we was at Dartmouth, they used Walmart's financials to teach us, right? And one of the things they showed us, now Walmart is $1 billion business. Walmart used other people's money to grow. Every time they're opening a new store, anytime they're doing an expansion, they're getting OPM. They're not even using their own money, and they got $1 billion. So if that wasn't enlightening for us to kind of understand this concept, because this is a business concept, right? Borrow the money, get you a low interest loan for a good length of time, so you can take the time you need to grow your business, right? Start your business and start growing your business. So it's a lot we can talk about OPM, but you want to secure funding, okay? Get your business plan, and you're going to need that business plan to get funding. Oh my God, we're working on an expansion right now. And we're looking at getting funding right now through the SBA. I thought our business plan was tight, like it's like 15 years old. And we've been updating it throughout the years, but we had to go through and tighten that thing up. And I'm glad we did, because it was some information that we really needed to see. So do your business plan, secure your funding, obtain your location. Like, you know, that is like the biggest thing for us. Like when we choose a home, and it's probably the reason why that's one of the things I have not delegated yet. Like I got to see the location, I got to see the home, I got to get the feel of it, because there's a litmus test I have. If I can't leave my mom there, or if I couldn't have left my grandmother there, it's not a part of it. It can't be a part of what we do. Don't pass the test. So, but go ahead and obtain your location. It's going to take time, and really it's going to take time now because the market is just it's crazy, right? The real estate market is a little crazy right now. So it just takes a little bit more time. And then you go ahead and apply for your permit. And we can help you with all these things that we just talked about on this checklist. Funding opportunities. These are a few funding opportunities that we wanted to recommend to you guys. Your local development authorities. Check with your local, your city, even your county sometimes have grants. And that's where they've gotten grants from the state or federal that they turn around and turn to you in a low interest loan. So always check with your city and your county to see if they have any funding. Community development financial institutions have fundings. And then of course your banks, right? Those are your traditional lenders have funding. Like I gave the example tonight that we were using SBA, and it's through a bank, right? They have funding. And then we have funding opportunities too. We have some in-house funding opportunities for some of the things that some of our senior care packages that we offer.
Sasha has a question.
Okay.
Is the business, I guess, a business plan? So is the business nonprofit or for profit? Are you a recommendation? Should she do a nonprofit or for profit? I think that's what you're saying. Because sometimes profits for profit can't get grants. Sasha, you need to be on our Green Table Senior Care Talk Show June the 9th. We're going to be talking about grants. Grants. You want to register. Everybody, go register for the Senior Care Talk Show. I'll drop the link for you all to register. We'll be dropping some tea on the Green Table. We just talked about funding, but just a shameless is not a shameless plug. It's great information. Yeah. We want to give you the information because that's what we thought too, Sasha, that, okay, we're for profit and we can't get grants. And so we talked to our speaker that's going to be on June the 9th, and she was like, what are you talking about? There are grants for profit businesses. So listen, we're going to be dropping the tea June 9th on grants.
And she also said there are more grants for nonprofits.
It is.
So we're fixing to dust off our nonprofit.
So have both.
Have both. We got both. So you want to be open to all opportunities. So yes, have both. All right. All right.
All right.
Industry secrets.
Y'all ready? Are you ready? Let me see some eyes. Let me see some ears. Are you all ready? This is what y'all been waiting for, right? We ready. We ready. Let's see. I think we have another question. How about opening home health care agencies? What advice can you give on that? Home care agency.
Well, we talked about that a little bit earlier. Now, when you say home health, are you talking about home care or are you talking about home health? Because there is a difference. And home health is skill care, and home care is non-skill care. That's when you send caregivers into the home to do bathing, dressing, meal preparation, light housekeeping. There's a difference. Mm-hmm. Oh, she says both. Well, we actually started doing in-home care. And the reason why and I think this is an industry secret too. So thank you for this question. But one of the main reasons why we started with in-home care versus any other senior care business, because it was a lower overhead. It was a lower, it was an easier, mm-hmm. Yeah. It was easier to enter into the business for one, less overhead. We actually did it in a business incubator for 3 years for free. And so that's what I would say to in-home care. Home health. Now we are registered nurses, but we never got into home health. We never got into skill care because this is where you're in Medicare dollars. There's definitely more money to be made. But of course the rules and regulations are more stringent. So we were very comfortable with what we were doing with serving seniors for in-home care. So we never got into the home health part of that type of business. Let's see.
Can you live in another county and have a business or a home in another county?
Girl, we got them all over the state of Georgia. So yes. You can have them in another state if you wanted to, but yes, you can.
Chantel, how do you start a personal care home
business?
I know. How do you start personal in-home care business? Personal in-home care business.
I don't know if she's saying personal care home or in-home care. Chantel, can you clarify that? LaQuanda, you got another one?
Who is this? Now I've messed up names.
Shanair.
Stay tuned, Shanair. That is what we do. We can help you start your business. We can help you do it, or we can do it for you. So that's what we do. And so we will definitely be going over that in just a few minutes. But listen, are you all ready? Y'all trying to sidetrack us? Are y'all ready for the industry secrets of what now? Yeah, what's going on? Let's see. My LLC is an adult daycare center, but also would like to expand and offer skill care. Can the two lines of business coexist under one business?
LaQuandra?
Y'all try to, yeah.
You want some industry secrets for real. So let me see how I can answer this question. So with adult day, there's a healthcare model anyway, where you have to have a registered nurse there and you're providing that level of skill care. That is the healthcare model of an adult day. You're providing skill care. However, you could look at partnering or opening your own therapy. Yes, providing therapy as a skill care component to your adult day. Knock it out the park. That's an industry secret. Okay. I just gave you an industry secret.
Okay, y'all listen. Y'all be listening now. Even though we answering questions, we still giving secrets out. Okay.
Yeah, you're not gonna hear that everywhere. Yeah, that's an industry secret. Did you get it? Okay.
All right. So we finna get on track now. Okay. the industry secrets. Are you ready?
She said having a contract. I think forming your own business. Well, you can have your own business, right? What if it was your own business and you hired PTOT to come do the work for you?
We're talking about getting them real dollars. Boo.
Yeah, yeah.
Are you ready?
Yeah. You do not have to be an RN to have a personal care home. You don't even have to be in the healthcare industry. And you can start any of these senior care businesses, okay? Whether it's adult day, personal care home, or in-home care. You do not have to be a healthcare professional.
Yeah, I better get like Janicia Boo. She said she wanted it all. She want to own it all. That's what I'm talking about. They said they ready.
All right, let's get these industry secrets. So I want to drop the first one. Was it Aisha who was asking about could she do personal care home and in-home care at the same time? So Aisha, we call this the flywheel. I don't know if this is on my next slide. I don't think it is. So I'm gonna go ahead and drop this nugget. So our flywheel, and that's a book, by the way. Please get it. Jess, can you put that in the chat?
Let me see.
It goes like this. It's called, can they see this? Oh, there we go. It goes like this. It's a flywheel. And so we started with in-home care, right? That was the first type of business we started with. When we were doing in-home care, we started learning about the other senior care businesses that we could offer that was still in line with our mission, which is to keep seniors in home or in the community. Now, at one point, we wanted it all. We wanted to be a one-stop shop, but we did make some changes. Back to the flywheel. But in-home care at the top, then we started adult day. And we could actually, because we were doing in-home care, we could see those clients who could benefit from adult day. So guess what? We start referring to ourselves. That's the next part on the wheel, right? We're going to make this wheel go round and round. So we had adult day, and we had the first sight of these people because we had the in-home care business, and we could see them in their homes, and we were communicating with our caregivers and our family members, and we wanted them to stay home longer, right? So they could come to the day center, get out of that home, get engagement, get socialization, and they were going to be seen by a nurse. They were going to get their medicines. If they needed any type of strengthening and things like that, we could make sure those things were happening at the adult day. All right. Now, some seniors, because we had a lot of seniors for a long time, some are going to continue to progress and they're going to need another level of care. Let me tell you about this flywheel. I'm going to go around a little bit more. Personal care home, right? So as they came to our adult day, we could see those who were getting ready to progress and was really needing to just come out the home altogether, right? And sometimes the family members they just don't have the time or can't give that added support. And sometimes the level of care has just advanced that much where they need to go to the next setting. We had a flywheel. Gotta make sure they can see this circle. So you can do them all at the same time. And I strongly recommend that you do, okay? Because you will have yourself a flywheel. That is an industry secret, okay? You're not going to hear that anywhere else. And we just dropped that nugget for you guys on tonight.
And let me tell you, let me put a cherry on top of that. And we can help you with all three of those. We have ran successful 7-figure businesses, is currently running 7-figure businesses, adult day, personal care home. We sold a 7-figure business in home care, so we can help you.
And then we added another layer up there at the top. We did the transportation. So we were just, it's just the flywheel, right? Like even though we did market, but we did have a good inside track on being able to make sure that we knew the businesses that we had would be okay. So that is a big nugget right there.
What comes after personal care home, then they're ready for the nursing home. So once you have excelled the need of care for personal care home, then they will have to get skilled care.
Right. But if you're doing a good job if you're doing a good job at all of these entry points I just talked about, you'll keep them in the community longer. Mm-hmm. That's the whole purpose of them getting these services, right? Do a good job, make sure that you're on top of them, and they won't have falls and break their hips. Or those things that, or they won't not be taking their medicine, or they won't not be eating, right? These are, so you're putting these services in place to catch all these things, to prevent those things that can make them really decline and need something like a nursing home.
Okay, Onika says, do you think I stand a chance here to bloom in this business?
Oh, somebody didn't see the statistics.
Absolutely.
Yes.
Absolutely. Yes, we need you, Onika. We need you. We need providers. We need people who are caring, who are compassionate, who have a purpose in serving, helping, who want to start a business. So yes, if that is what you do, no matter, you mean in Pennsylvania, it doesn't matter where you are.
It don't matter.
We can help you.
Yeah. Yeah. And the numbers supported. If you don't believe us, go to AARP. Just go to the website and start looking at the senior numbers that are coming our way.
Let me tell you this. We started 15 years ago. Our population in our community was 15,000. Mm-hmm. 15,000 was our population. And we have generated over 20 million in lifetime sales. So Pennsylvania, wherever you are, if we can do it in rural Georgia, yes, so can you. So can you.
That's right. That's right. All right. I think we got some more top secrets that we're going to drop on tonight. What else we got, Jess?
Oops. Here's one. Are you ready? 8 streams of income. Who wants to hear this? Can I get a hand raised? Can I get some eyes? Can I get a yes? Can I get a me? We want to tell you about 8 streams of income.
Yeah. Mm-hmm. So we have learned how to generate 8 different streams of income with our senior care business. Now, we're not going to drop all this tea on tonight. We're going to have actually a green table talk show coming up talking specifically about this. But we just want you guys to know.
Also, we're going to have a pop-up talking about this.
Yeah, and it's going to be in Atlanta at the Gathering Spot, if I'm not mistaken. We'll be bringing you more information on that.
You all need to get connected with us. And so I'm going to drop that as well, how you can stay connected, because I'm telling you, we spilling all the tea here.
Can I tell them one? Let me tell y'all. Can I tell them one?
She's going to tell you one.
I might tell you two. One is the business is going to pay you, right? Just like you got paid at another job, your business can pay you a salary. That's one of our streams of income. We got 8, we got 7 more. So we want you guys to learn these secrets, right? Learn how to be savvy in business. So we're going to be talking about that. I think it's in August, if I'm not mistaken, Jess. We'll be having actually coming to Atlanta to the Gathering Spot, and that is going to be the topic of discussion: how to generate 8 streams of income. Yes.
Yep. Yes. August the 18th. All right. Are you going to give them one more? One more for the people.
Let's see. They're all so good. Okay. 2 is going to be rental.
They want don't worry.
What happened?
Sinead, they want to guess one.
Oh, let's let somebody. Well, I gave y'all one, and then we'll let them. I gave them 2, and then they can guess one. One is rental income. Yes, that is a way you can get 8 streams of income from your senior care business. Rental income. All right, just can somebody give us one, Shanair? You gonna guess one? And then y'all will come out with 3.
There's referral income, investing. Somebody said referrals, transportation. That's right.
So is that Nicole?
Nigeria? Not Lord.
Nicole, you're right. Investing is the 3rd one. So we have stocks. Our senior care business owns stock account, and we are investing. And that is a third stream of income. Y'all got 3 of the 8 on tonight.
Y'all pushing it. Y'all pushing it.
All right. And another secret, which I kind of hit on it when I talked about rental income, but real estate, that is not spelled right, but it's real estate investment. Well, I guess it is real investment.
Either way.
Either way you
it's
look
both.
at it. But you can actually have a real estate portfolio by investing in senior living options. So we want you to know that is a nugget on tonight. Please don't sleep on it. We dropping a nugget here tonight. Don't sleep on it.
So you've heard us, you've heard us talking, you've heard our story, you've heard the need. Now I have a question for you. Are you worth it? Absolutely. And so I really need you all to put in the chat, yes, I am worth it. Because I want you to know, if you want to make a difference in your community, yes, you are worth it. If you want to be a 6-figure, 7-figure business owner, I need to see you say, yes, I am worth it. If you want to make a difference in the baby boomers' lives and keep them in the community, say, yes, I am worth it. If you want to have financial freedom, who wants to have financial freedom? Who wants to generate generational wealth? Who wants to have life-changing revenue? I'm talking about, yes, you can. You are worth it. We are depending on you. We need you in this industry. We want to help you. So if you're ready, if you think you're worth it, let me show you how we can help you. You all been asking, is the Senior Care Business Incubator Masterclass? Let me tell you what all the incubator has in store. It's a training of modular 6 trainings that we have for you. And we're going to go through and we're going to just tell you we're going to go over all the senior care businesses. We're going to tell you how to decide which senior care business is right for you. All those things that you said you had a challenge with: funding, business plan, doing it on your own, filling your beds, finding location, marketing. We're going to help you do that in this Senior Care Business Incubator. And not only that, we're going to have group coaching calls. We're going to have a private Facebook group. I'm telling you, we have so much in store. Let me just read it off to you all. Again, which type of senior care business is right for you? The rules and regulations. No matter what state you're in, no matter where you are, this course, the Senior Care Incubator, is right for you. We're going to talk to you. We're going to lay it all out on the line. You saw it. We have wealth of information. We want to give it out. Yes. And so we need you all to, if you're ready to start your senior care business, you've been holding back. You've been waiting on the right time. I've given you the statistics. The time is now and the time is right. You want to ride that wave into the senior care industry. And so we want to help you. This is a total value of $2,882. But for our VIP, because you all are VIP, you're very important people. You're very special to us. So we got an exclusive deal for you on tonight and tonight only. So with you signing up with us today, you're going to save nearly $1,100 on our value price. Who's ready for that? Because you said you're worth it. Now I want to know if you're ready to do the work, ready to start to enter into this senior care space. That's right. an irresistible offer.
That's right.
We don't want you to get quiet now. It's no need to get quiet now. We want to help you. We want, you've been excited. We want you to stay excited. So we have bonuses. Again, we're going to, not only are we going to walk you through those 6 weeks, those 6 modules, but we're going to give you templates, right? We know you need a roadmap. So we're going to give you templates. We're going to give you a checklist to launch your business. We're going to give you VIP ticket access to our Senior Care Business conference. And so then lifetime access to the course. So you can always look back. You can always refer back. I'm telling you, we want to hold anything back from you. So, all right.
Do we have any other questions? Thank you guys for tonight. Thank you for attending. I hope we shared with you guys some nuggets that you guys, things that you haven't heard before, because we wanted to give y'all some industry nuggets, some industry secrets on tonight. And we will be following up. So
you all stay tuned, get connected, be looking out for our emails, check your spam. I know they may go there, but we're going to be telling you how you can join our Senior Care Business community, how you can just follow us on Facebook, stay connected, get on the Green Table Talk, all of those great things. But I want to make sure you all don't forget the VIP offer, because I'm telling you, this is something we've never done before. I don't know if we'll do it again, but the promo code is VIP. That expires tomorrow at 11:59 p.m. And then I just want to make sure you see all the things that you're going to get, the bonuses, and then what the courses entail. We're literally handing you a senior care business, ready to go. So if you're ready, if you've been hitting roadblocks, or you just don't want to do it alone, we can help you. Modules are at your own pace.
Lifetime access. Don't want to leave that out. And we go live. We go live with you bi-weekly to do Q&A over the modules. So don't want to leave that out as well.
And LaQuandra, we have other products where we can do it with you or do it for you. But stay connected to us, and we can definitely show you, tell you about that as well. But the first step is to go through the incubator.
All right.
Thank you, everyone. You all have a good night, and we're going to leave it up. I'm going to still try to drop some links in, but again, we're going to be emailing you all of everything that we talked about. Thank you, and have a good night.
Good night, everyone.